Hello, Millennium Live listeners. Glad to be back here for another episode of the Millennium Live podcast partnership series. And we have a great partner with us. We have Gozio Health. And today's topic of discussion is why a mobile native experience is such an important part of your digital strategy. And we're going to explore those areas with Lea Chatham. She is the Vice President of Marketing at Gozio Health. I want to welcome her to the podcast. Lea, welcome. Happy to have you here.
Thank you so much. Thank you so much for having me.
Of course. So, as we mentioned in the little intro there, we want to talk about mobile and the role it plays in healthcare. So, just to kick things off, I think it's a good way to start. Is what is the role mobile has been playing in a patient experience way and a patient engagement.
We know that people are using their mobile devices all the time, right? So if we just look at general overall data around mobile usage, most Americans have a mobile phone. Most Americans have a smartphone. Most of them are regularly texting and using apps and doing things on their phone to engage pretty much in every other part of their life, right? Restaurants and travel and you name it, you're probably using your phone for it. And healthcare has been a little bit slow to kind of get on this mobile bandwagon of, hey, this is where people are and it's where they want to engage with us. But there are a lot of opportunities and ways to use mobile to connect with patients, engage with them, and kind of offer them the experience they have everywhere else. And we know that patients want that. There have been a number of surveys where patients have said, I really want the same kind of digital experience or customer service experience or access experience, in healthcare that I have in retail or travel, hospitality, whatever. So I think we're moving in that direction, but there's a lot of opportunity.
Great. I mean, what we do know is that what engages patients is no longer a mystery, and people in general are very much glued to their phones. So it's a good
Yeah.
segue for my next question, which is diving into really the meaning behind mobile native. I know a mobile native app is, specifically designed for the mobile device and usually offers some better performance and better user experiences. So, from your perspective, Leah, what does mobile native really mean?
In healthcare specifically, we again have been a little bit behind, right? People are thinking of mobile often as it relates to their website and a mobile optimized website, or maybe offering something like a patient portal on mobile. It's sort of optimized, again, kind of optimized for mobile. But those experiences are not mobile native. So mobile native means it's been built for your mobile device, right? It's specific to Android or iOS. It is able to utilize all the features and functions and tools and sensors that your phone has, things that we're very used to using all the time now, like talk to text or my location, right? Things like that we use to sort of navigate around and order our Starbucks and do all those things. Those things are only available in a mobile native experience. So when you have a mobile optimized website or portal, that's a sort of a step in the right direction, but you're still very likely to have to do kind of the pinch and drag and pull and, trying to get the place where you have to tap the button, or whatever, scrolling down the page, versus something that really is just designed where it's all right there on your phone and it's really easy to tap and click and move forward, or use, your voice settings, or just say my location, take me there, those kinds of things. So it really is that next step of creating a much more mobile friendly kind of engaging experience, like you have if you were using something, like to do a restaurant reservation, right? Where you're able to sort of say, like, find me restaurants that have reservations at 6 p.m., in this neighborhood, at Italian food, right? It's like, that's the mobile native experience, is like, I can say all those things, it's going to serve it up to me. Or I'm going to say, like, give me directions to wherever, and it's going to say, I have your location, here are your directions, right? And you click and tell it, I'm walking, I'm driving, whatever. Those are all mobile native things.
Yeah, that's really interesting, and that's great. But why does it matter? Why does it matter if the experience is native versus an optimized website or a patient portal on your PC?
I think it matters because healthcare is very complicated, right? It's a complex experience and the patient journey is kind of complicated. And people are very frustrated with things like how long it takes to get an appointment, how long you often wait on hold for an appointment, navigating really big, complex healthcare campuses and finding your way around and being able to do those things. There's a lot of friction in healthcare. And while a mobile optimized website or portal is nice, and those are important features, it's not that we don't want them or we don't think they have value. It's just they still create some friction when it comes to finding what you're looking for, and being able to take the next steps easily to get sort of where you want to go, right? And so we kind of continue to have these stumbling blocks in the sense of how we navigate an experience as a patient to get what we need, right? And if our goal right now, as many healthcare executives say, is improving patient access. There have been several surveys over the last year or so where healthcare leaders have said, really, some of our top priorities are improving patient access, reducing referral revenue leakage, things like that, trying to keep patients in network and engaged and making their appointments and doing all those things. We want to try to remove as much friction as possible. So if you can pull up an app on your phone for the health system you most commonly use for your care, and you're able to very easily see all the urgent cares near you based on your location with the ability to save your spot and navigate there. Or you're able to say, I'm looking for a female OBGYN in this neighborhood who has appointment availability this week. Those are huge reductions in sort of friction and challenges around the patient journey. It's a much better experience for patients. It makes it so much easier for them to access care.
Right. And I want to get into, meeting the expectations of patients, but what should a health system look for in a mobile platform, in a mobile native device? And excuse me, how can
Yeah.
systems make sure that they are meeting patients' needs and meeting expectations?
Yeah, and we sort of think about those actually as kind of one thing, right? Mobile strategy, sort of what do you need in a platform? How do you make sure that you're getting everything patients are looking for? And the way we think about it is what you want to look for is sort of a foundational framework, a mobile foundational framework that's already been built by someone who really has that deep experience and knowledge of that mobile native experience, so that all the things you need to do, which are a lot. There's a lot of things in building building a mobile app, right? There's like user experience and user stories and brand colors and all these sort of like UX things. Then there's the piece that is like it's got to be Android and iOS. You've got to make sure it works on all these devices. You need to meet accessibility standards, right? The list is long for all the things you need to do. So what you want is someone's already done all that. And the platform sort of sits there as a foundation for you to build on. And that allows the health systems then to say, well, these are all the things that I want in my mobile. These are all my patient facing tools that I have. And, one thing we know is that while health systems may choose different vendors or they may take a slightly different approach, the core problems they're facing are largely the same. So if you have a platform that's pretty vendor agnostic, that lets you plug in what you've chosen as kind of your best in class solutions for provider search and appointment scheduling and your AI voice assistant and your bill pay and your portal and all those things, a good framework will sort of be ready for that, right? Able to kind of take all those APIs and data feeds, and maybe some of them are still link out, like web link outs or whatever it is, and plug those in. And we find that about 80% of what you need in a mobile app is that stuff. It's the stuff that everybody needs. It's the stuff that everyone probably already has or is working on today. And then you want to have the flexibility for those very custom, unusual things, right? There is a little part, 10 or 20% for every health system that's like, this is very unique to us. Only we do this, right? I'll give you an example of a client we work with who has a huge art installation in their main campus of their health system. And they wanted to have like a tour of their art stuff for when people were sort of stuck there and needed something to do, right? Some people have gardens or meditation areas or things like, right? That's very unique to you. Maybe you have some kind of, I don't know, a pharmacy situation where you want to be able to have people get their prescriptions and get an alert when they're ready or whatever. Those are really custom. So while you want this framework and the ability to plug all those things in, you also want it to be an open platform that allows you to do some custom development for the things that are really unique to you, and that allows you to shift and change over time, right? We saw with the pandemic, things can change on a dime and suddenly you've got a whole new set of problems, right? And issues, and you've got to go solve those. And maybe you need to be pushing out notifications, or now everybody has to come through one door, or, only do be here or go there to be able to do those. So, easy to plug in the 80%, some custom development and open platform for the little 10 or 20%, and then the ability to easily kind of change and adapt over time, I think, are the key things in finding a mobile platform that can deliver all the things patients are looking for.
Right. And I think you hit a couple of great touch points there. And one of the things that point out to me is really sustaining that growth, right? And keeping those members coming in to those doors. And that's where I kind of want to lead to. I know another thing you mentioned was ease of access, and that's really key for a patient experience. So what are some other things that you've seen out there, Lea, that what patients are looking for in a platform like this to manage their healthcare?
Yeah, so I think there's been a lot of research over the last decade or so about what patients kind of want. Um, a, One of there's really two sort of top challenges patients always report when you ask patients, what are the most difficult things about healthcare? They will generally say, it takes a long time to get appointments. It takes a long time. I'm waiting. It's not just that I'm waiting for the appointment, right? I wait on phone to schedule the appointment. Then I wait like 3 weeks to get the appointment. And then I get there and I wait for 30 minutes in the waiting room, right? All the waiting related stuff. So being able to find appointments and schedule appointments kind of on your time on a mobile device is a big one, because often we find when you can do that, you can get an appointment sooner. So that there's a lot of research that suggests people will select an earlier appointment if they can see all the options. So that's a big one, is the ability to sort of find those appointments, schedule them, hopefully get in sooner, and schedule the appointment really quickly. Another one is bill pay. So we know that patients are consistently frustrated about sort of billing and costs and transparency around that. So the ability to offer cost calculators and information ahead of time, as many are now required to do, right, about what the cost will be, being able to get your insurance verification done by submitting your information, and then being able to pay a bill really easily, right? Those are big things. But there's also a lot of research to suggest that there are some other things that are a lot where the adoption is much lower currently in healthcare. So one of those is AI chat, right? Makes it very easy for people to just ask questions and get answers. Another one is wayfinding. So about 70% of patients say that they would love to have good digital wayfinding to get them around complex hospital campuses because it's very frustrating and stressful. I think anything that really helps you, it could be triage. We know that that's helpful, even though patients may not say that's their top thing. Triage or symptom checkers, they actually get used a lot when people know it's available to them. So there's a lot of things you can do that the patients, some of which patients have said in huge numbers, we really want these: online scheduling, bill pay, wayfinding. Some of which are things patients don't know they want until they get them. And then it's like, wow, those symptom checkers and AI chat, right? It's like those things are like, I didn't even know I wanted that, but now that I have it, that's amazing.
Yeah, is there someone there? It's I feel like that's great, because that's really meeting patients where they are, and of course that's going to drive better outcomes, and an experience like this is only going to make healthcare easier, right? So in other ways, how can systems really keep innovating in that patient experience, and where do you see solutions like something, like a platform like Gozio Health provides, um, help? How is that helping systems continue
Yeah.
their innovation? I know, as you mentioned earlier, healthcare could be always behind a little bit, a little couple steps
Well,
behind
just
in
a
their
little bit.
transformation. So, where do you see this?
I think, I think one of the things that can stifle innovation is that you have too many things in your tech stack and maybe even overlapping solutions in your tech stack, right? And what you really want is to try to figure out where maybe are we overlapping, where are we not taking advantage of the tools that we have to maximum capacity. So there's a governance piece that is really taking a look at your technology and are we making the most of what we have? Do we have too many? There was a recent study last year that said on average health systems have 9 telehealth solutions coming out of the pandemic. Kind of going through that process of saying,
Mm.
oh, okay, well, which one is the best one, right? And let's get rid of the other ones. um, and then having partners who are willing then to work together to help you kind of make the most of those. So if you have a platform like Gozio that's vendor agnostic and willing to work with your sort of top choices there to help boost adoption and really maximize that patient-facing technology. So a great example is healthit.gov just released the latest numbers on portal usage. And people who used a mobile app to access the portal more and more often. And but the portal adoption at the highest level was still only about 30% of people were reusing it over and over again. When you have a really well-made branded mobile app that's designed to drive engagement, designed to put everything in one place, where its intention is let's get people using these, various pieces that you have like it's all one thing, we see reuse rates of 70 to 80%. So that people coming back over and over again and utilizing your app and accessing your portal adoption is higher because it's in this larger app where all these other things are. So there's a process, I think, of figuring out what are our best solutions and how are we going to maximize them, and then partnering with interdepartmentally and then externally with vendors to say, how can you help us make the most of what we have and increase adoption and engagement there? And that's really where we kind of can come in and be a partner.
Yeah, and that is a perfect segue to my last question. I don't want to keep you too long. I know you're very busy and traveling everywhere, Leah. So, one of the things I want to recap is that from what I'm taking out of this conversation is really systems should be looking to deliver that value and that experience, and that's all should be part of and integrated into that digital strategy. So, if you have a piece of advice, and of course, I want to bring in Gozio Health and the great platform that you offer. If you could give one piece of advice to healthcare leaders who are in the midst of choosing solutions and have a lot that come across their desks, why something like Gozio would be extremely helpful to them?
My one big piece of advice for systems who haven't already done this is to make your digital strategy something that is very collaborative across departments, where you have input from marketing and patient experience and patient access and IT, and you really have a deep understanding of what are our goals, what are we trying to do with our digital strategy and our patient engagement strategy, and to really take the time to kind of map that out and understand what are our challenges, what do we need to do to try to solve them. And then an organization like Gozio can really come in and say, hey, here's what other really successful organizations have done to take their digital strategy and mobile to kind of to the next level, right? Where they've got hundreds of thousands of patients engaging over and over and over again. And here's how you do that. So it's important, I think, to be collaborative and understand your needs internally and really be clear about what you need to do, what your goals are, what you're trying to solve for, and then pick a partner who has a lot of experience in that and has done it successfully for other organizations before. And it's always good to ask, right? Say, I want to talk to somebody you've done this with before. I think that
Very
would be my
true.
last piece of advice. Always ask, always always say, like, I want to talk to somebody who looks like me, an organization that looks like me. And ideally go download their app and go to their health system and walk around and use their wayfinding or whatever it is. Test it out. Make sure that you feel good about it.
Totally agree with that. So it's a perfect way to end. Lea, thank you so much for your time. Thanks for teaching me and our audience a little bit about why a mobile native experience is such an important and integral part of health systems digital strategy, and why that's so beneficial to both the system and the patient. Lea Chatham, thank you so much. Vice President Marketing at Gozio Health. I have all the details about Gozio in the description of this podcast. Thanks for listening, and thanks again to you, Lea, for joining.
Yeah, thanks for having me.